The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. With us we have board-certified plastic surgeon, Dr. Ahmadi. Dr. Ahmadi, welcome to the program.
Thank you for having me, Randy.
Always a pleasure to have you on the show.
It's good to be here back.
We've had you here on a couple of topics.
That's right.
Now, before we get into today's topic, for those that don't know you, tell us a little bit about your practice.
Well, as you said, I'm a board-certified plastic surgeon. And recently we have moved to our new office. It's a
huge place.
That's right. We have our own operating room, recovery room, and it's been a blessing for us. We're very excited about it.
I understand it's state certified. What does that mean?
Well, we're basically an ambulatory surgery center, meaning that the state oversees us, so we are a little more stringent about the qualifications and ruling.
Every time you're on the show, we talk. I mean, you're big on safety.
Correct. That is an integral part of doing any sort of a plastic surgery nowadays, as you know, with the news media, etc. It's been a hot topic nowadays, and we want to make sure that we deliver safe procedure to our patients.
So moving on to today's topic, facelift. I mean, what's changed over the last 20 years?
Probably we are less aggressive with our knives, and we have incorporated more technology, such as fillers, Botox, and laser.
So you do all of that?
Correct, and by integrating all those concepts, you can deliver a more natural look and less of the lifted wind tunnel look that you have seen in the books and magazines of the Hollywood actresses, etc., from the 60s.
Yeah, now you say you attract somebody that wants a natural
Correct.
look.
The whole idea is to make sure that the patient gets what they want, but at the same time, they're not overdone. You have seen the overdone looks, and it's hard to correct them once they have been done so. It's best to approach it in a very calm, artistic fashion rather than a very surgical and steel-like fashion.
So this is, I mean, how much art, how much science?
I think
in the facelift or any type of
yes.
procedure like this.
It's a blend. You need to have some artistic talent to become a plastic surgeon, especially for the face. But there's also science to it. There are proportions, there are lines, there are angles that you need to follow. Even though there are some textbook measurements, etc., at the end, you cannot apply millimeters and centimeters to everybody's face and expect the result to come natural. Because at the end of the case, you look at what you have done and you may adjust it. And those adjustments may not necessarily be measurements that you were taught, but whatever looks natural for the patient. So
what are the age ranges of the women? Are they getting younger and younger, older and older?
Well, there is the concept of facial rejuvenation is beautiful, meaning that it applies to all sorts of ages. If you take an aging face, probably starts in the mid-30s by lines around the mouth, the neck's dropping, becoming less of an angled neck, and then moving up the face to more tired look around the eyes and more lines around the eye lines, etc., until to the point that the entire face looks tired, the nose plunging down.
Is that what they tell you? I mean, on a consult? I mean, what are the complaints? I mean, what do you hear?
Well, everybody has a different complaint, but for the most part, they complain about looking tired. They're tired of looking in the mirror and seeing the lines or the folds around the mouth or the neck that is not tight anymore. And what I commonly see is they walk into the office with pictures of themselves from 10, 20, 30 years younger, and they tell me, please make me something like what I was before.
And is that possible? I mean, to turn back 10 years, 15 years?
It is, but it has to be approached naturally, obviously. Let me give you a very extreme example. We have seen, obviously, ladies, even on on TV, etc., and I don't want to name a whole lot of celebrities, that they get these extreme procedures. Now, when they age, since the procedures were done in such an extreme, the body is not in harmony, the face is not in harmony with the body. So here you have a very, very, very young looking on a very, very aged body. So harmonious aging is another thing that we need to achieve.
So you don't want it too perfect? I mean, is that what you're...
Correct. Perfection is not the answer. You cannot take the face and make it perfect while the rest of the body has not been worked on. So it has to be harmonious. It has to be done very intelligently. Natural looks should apply to the entire body, not necessarily just the face.
Now, the younger patients
yes,
that are getting facelifts, I mean, in their 40s, you're saying?
Well, let's not call it a facelift, let's call it facial rejuvenation. And just to give you an example, what a bad facelift done at an inappropriate time can do to you. Let's take a 14-year-old lady, 14-year-old girl, and let's do a facelift on her. what do you imagine she's going to look like?
I guess very strange.
Very strange, correct. So when you apply a very tight pull, what you call facelift, to somebody who's not a candidate for it, they're going to look absolutely strange. Now that's an extreme example.
Okay.
That's a very extreme example.
A 14-year-old, yeah, that looks
correct.
strange. Okay.
At the same time, you don't want to look a much older lady to look 30 years old, and that's a flip example of it. So it goes both ways. And in the middle, these two have to meet. Meaning natural looking, when you walk up to somebody, they know they have had something done, but they can't pinpoint it. They can't see the scars.
And I told you, I said, I feel like I can spot a good facelift, 20 yards away. And you said not one of mine.
If you can spot it from 20 yards away, then that's a bad facelift.
Okay, because I feel like I have an eye for it nowadays.
You probably have seen enough, correct.
Seen
You've been in this business long enough to pinpoint these things, but if you can spot a facelift from 20 yards away, that's a bad facelift at this point.
Okay.
Because by the time you get to about a few yards, you know that you can see the scars, they've been pulled too tight, the corners of the mouth are going towards the ears, and the eyes, they can barely blink.
Right. Now, do you think that the most people think that all surgeons are doing facelifts the same way? Are they, or are there big differences?
There are differences and variations in technique, and not every single technique applies to the same patient. You cannot do the same technique over and over and expect to get good results for different patients. Everybody is different. What makes a good surgeon is one who can take a look at a patient, listen to them, see what they want, and get there in the simplest and the safest way, and have enough of an experience and knowledge to vary the technique during the procedure to achieve an optimal result.
Now, they say artists can see the end result before doing it. I mean, when you see it, do you say, boy, they'd be perfect?
You need to have a vision. Even during the consult, while they're talking to me, I can see them after the facelift.
You really can in your eye.
If you have done enough faces, and you should be able to envision them. Okay, what's going to happen? The lines are going to go away, the corners of the mouth are going to be softer, etc. I'm going to make the neck tighter. Yes, I can see this patient coming in a few weeks and smiling and thanking me.
Okay, so can a 40-year-old look 30? I mean, do you ever hear that? I realize it's tough to put an age on something, but do you hear that?
Yes, of course. But then again, that 40-year-old may be a candidate for a facelift if she was she had not been taking care of her skin, and she may need some surgery. But more than likely, that 40-year-old can be corrected and rejuvenated with minimal non-surgical stuff such as Botox or fillers, to plumb up the face, because she has not gone through the aging process completely. It's not volume loss that we're looking at. We're just thinking about shifting the volumes around, upward.
Okay.
And the concept of vectors, I'm sure that we'll talk about, really apply in
Vectors what?
Vectors.
Like the direction of pull when you're doing a...
That's a simple way of putting it. And basically, in the past, there was only one direction of the pull. You're going to pull everything from the corner of the mouth towards the ears.
So just pull everything back?
Pull everything
back. In the old days. And that was the training?
That was the training. But now it seems that every portion of the face has its own vector, meaning that the neck needs to go towards the back. And as you go further up the face, the vectors turn more towards the middle. So what was done previously, where everything went in one direction, has been changed to what we call a multi-vector facelift, where every part of the face gets pulled in different directions.
For a natural?
For a natural, to achieve a natural look.
Interesting.
Yes.
Now, I guess some people are doing more of a skin pull, then there's, the muscles underneath.
Well, as I mentioned earlier, not every procedure is not good for every single person. While, let's say, a 40-year-old, 45-year-old lady may be a candidate for just a skin pull, a 50 or 60-year-old lady may require some sort of muscle, skin, and skin resurfacing to make her look younger and give her that rejuvenated look.
So you brought some photos. What are we looking at here? What do you have for us?
This is a lady who came complaining mostly about her neck. And Randy, I want you to take a look at how droopy her neck is.
This is a young gal, looks like.
She's a young gal, very beautiful lady. What I noticed during the consultation, that even though the neck was an issue, her chin was a little weak. So what I did...
You say weak chin, meaning?
Weak chin meaning that she doesn't have a whole lot of projection. And I brought that to her attention, and what I offered her was liposuction of the neck to define her jaw angle. Then, through a tiny incision, over the chin, I was able to tighten the neck muscles, also known as platysmoplasty, and put a small implant, not a big implant. Just
a chin implant?
A chin implant,
okay,
to give it a subtle look. And you can see
it doesn't look like the same gal.
She doesn't look very strong.
She looks like she lost
jaw.
20 pounds or something.
It does have that effect on people once you tighten up the neck and give them that extra angle of the jaw.
It's very nice.
It looks like they're much younger. And
so when it's done, do they say that the people compliment them? They can't quite pinpoint what was done? Because even though this is subtle, it's really changed her look.
People do tell them that they've had something, they think that they have something done, but they can't pinpoint it. They tell them, you look younger. What have you done? Are you eating better? Are you exercising?
Oh, okay.
Yeah. Now let's go over this gentleman, a male, who, and I want you to concentrate on the before picture. Very weak chin. The chin is completely back, very full neck. You can't see the jaw lines.
Now, when he comes to you on a consult, does he tell you, yeah, I don't like my chin?
They don't necessarily know that. This gentleman came actually for just rhinoplasty. And if you look at the nose, the tip is plunging a little bit, and he's got a little bit of a hump over his nose.
Okay.
And this is a very common combination that we see, that the nose is a little prominent, the neck is weak, meaning that it's full, and the chin is recessed, not projecting. So what I offered him was rhinoplasty, a chin implant, and liposuction of the neck. And you can see the difference. He's completely changed his face. On this side view,
it's like a chiseled face. I mean,
it's
a nice neck.
very angular face, and he's got a very strong jawline. The chin is in the proper position.
So that chin, just a small little implant.
It's a very small implant, and if you look at the nose, the tip is up, the tip is refined, and the hump is gone. Even though the changes are subtle, but when you add all these little bits and pieces together, it changes somebody's figure completely.
He also looks. When you put the before and after side by side, almost more sophisticated on the after.
Correct, and he's a very good friend of mine, and the story is that I've known him since college, and walked into this office, and after he's had his rhinoplasty and his facial work by me, and the first lady that he met, he married.
Is that right?
That's right. And they're still very happily married.
Because his confidence, his self-esteem was up.
I believe so, and he was a very shy guy when we were back in college together, and after this, he became quite
That's a good
different
story.
guy, yeah.
I mean, do you see that you make small changes with certain people and their personality changes?
Well, that's the artistic part of the whole consult. The scientific part is how to do something. The artistic part is recognizing and translating the words into little bits of pieces of surgery.
Okay.
That's the translation part, and art comes into that. And the smoother the transaction goes, the happier the patient will be.
Okay. Okay. Now this woman, you have a woman over there.
Now let's move on to some rhinoplasty cases, and
that's nose, like
nose job, basically. Okay. And the point I want to make is that a Caucasian nose is not for everybody. She's a very beautiful ethnic lady, and if you notice, she's got a little bit of a hump over her nose.
Very small.
Very small, subtle, and the tip is pointing down.
And it bothered her.
It bothered her quite a bit, as a matter of fact. And what I did for her, I removed the hump and redefined the tip and lifted up a little bit. Even though the changes are very subtle, you can see it's changed her figure.
Okay, so in the after and the before, yeah, very nice. And noses, you like doing noses?
I like doing noses because I understand them. I have an engineering background, so I can understand
I met
noses.
a lot of guys, I told you this, and they don't like doing noses. Why do you like doing noses?
Noses are difficult to do in a sense that building a house. When you build a house, you have to lay down the foundations properly. Everything else goes on top. So if you don't understand the nose and you don't understand the foundations, a few degrees of miscalculation, removing too much, can later on damage the house. If you lay down the foundation wrong for a house, it doesn't matter what you build on top. No matter how pretty it is, it will collapse at the end.
So the nose, one of the trickier procedures in the world of plastic surgery?
It can be, and I've seen a lot of plastic surgeons who shy away from it and refer them to me. You have to have an understanding of the nose. It's probably one of the areas of the face that requires solid thinking, meaning that you cannot overdo it. It can change itself later, and it has to be approached in a very mathematical way.
Is that right?
Correct. There are measurements, there are angles, and there are more angles and more textbooks that will be written for rhinoplasty than any other field in plastic surgery. Let me give you another example of rhinoplasty. And beautiful Caucasian lady. Now her nose has different issues.
Yeah, I mean, it looks pretty good to me.
Right, exactly. With most,
but what bothered her? I mean,
with most Caucasian
at?
ladies, the angles are fine, but in her, the complaint was subtle. I don't like the hump on my nose.
Okay.
So all I did for her was remove the hump, even though it's subtle. You can see how it changed her figure, and define the tip a little bit. She had a little button nose.
So you picked it up a little bit?
Not necessarily picking up. I just defined the tip, meaning that made it a little bit narrower. So on profile, she had a more angled, chiseled look. Let's look at some eyelid procedures. Beautiful lady. Her complaint was, I look tired and angry.
She looks pretty good to me.
She looks good, but I'll show you what the problems were. She basically didn't like how her upper eyelids were hanging over her eyes, and she didn't like the folds around the corners of her mouth. She also didn't like the circles around her eyes and the fullness on there. Now, this is an example where an inexperienced plastic surgeon could go wrong. Even though her upper eyelids need a procedure that we call blepharoplasty or eyelid tuck, the lower eyelids, by someone inexperienced, would be approached by a procedure known as fat removal, etc., whereas that didn't need to be done on her. What I did for her, I removed some skin from the upper eyelid, and you can see what the difference is. You can barely see the scars. And instead of removing fat, I plumbed her under eyes.
I mean, she does look completely different.
Right, so
very soft.
So surgery, removing things and cutting things is not always the answer. Sometimes you have to add things. And I did the same thing for her folds, and you can see that she looks much, much happier on the picture.
It's a softer look.
It's a much softer look.
Very pretty. Now, over the eyes, though, you did a blepharoplasty over the eyes.
Correct. It's a very technical procedure. This is an area that should be approached very subtly, meaning that even a millimeter of excess skin removal can really give you a very, very hollowed out look.
So you took skin from over her eyes, the blepharoplasty?
Yes, and a common mistake that gets done by inexperienced plastic surgeons or other cosmetic surgeons that are not properly trained is to remove too much. Sometimes
what happens with too much?
If that happens, which is a very difficult thing to correct, they get a very aged cadaveric look, and it's
skeletal. I see that.
Very skeletal, very hollowed out, very aged.
Interesting.
And the best approach sometimes is the simplest approach. Remove less, and you can see that even though a subtle procedure was done, the difference was significant.
She looks younger. I mean, there's no doubt about it, but she looks much prettier.
She's much happier. She looks happier. That's the whole thing. She looks happier.
Okay, okay. Does she say, now do people react to her differently? I mean, does she tell you that?
She has mentioned to me several times that when her friends approach her, they tell her that initially when she had the procedure done, that they felt that she looked happier, basically smiling more, even though she's never been considered an unfriendly person and things like that, and they kept inquiring whether she had any procedure done, etc. But they could never point out what she had done. Do you think at 20 yards away you can spot her that she's?
Well, I say that I can spot it. No, if I saw her, I mean, you wouldn't
Probably
know.
Not.
She just looks like a natural beauty.
Very subtle. She's a beautiful lady. Just a very subtle changes.
You know that so-called done look? Now we're filming here in California, and we're known for
very common,
sometimes Newport Beach, that done look. I mean,
we don't want to do that.
Okay.
Those are mistakes that were done in the past. The plastic surgeons nowadays should know better than creating those very hollowed out looks, those pull lifts, those extremely pulled faces. The approach should be subtle.
Okay.
And appropriate for the age.
All right, now we are just about out of time. You have a few more.
Yes.
Let's take a look.
The next lady also had blepharoplasty eyelid procedure done. Well, look at her eyes. Beautiful eyes, almond, but draped and covered by extra skin of the upper eyelids and bags under the eyes. So it gave her a very tired look. You can barely see the beautiful eyes, and that's what bothered her. So what I did for her was a little bit different. I did the same procedure for the upper eyes. Did not remove a whole lot of skin.
Big difference.
Very little. What I want to emphasize is that in her case, I did lower eyelid surgery, unlike the lady before, where I plumbed her up with the filler material. I did eyelid surgery, but instead of removing the fat from eyelids, which is easy, commonly done, and most of the time it results that a skeletal look that you're referring to. I drape the fat over the soft tissue of the mid-face.
So you use your own fat?
Her own fat to plumb up the eyes and efface those lines that are known as, that you commonly refer to as a tired look. Look at the eyes before. You can see the puffiness under the eyes. You can see the lines under the eyes, and after, completely gone.
Even though it's subtle, it is
completely gone. Absolutely.
Big difference.
Big difference.
And these are young patients. So younger patients are going in and getting these procedures.
Well, she's about mid-40s, and this is an appropriate procedure for her.
Looks good.
The lady before was a little bit younger, so she didn't need that procedure. She needed something a little bit subtler. See the difference?
Yeah.
It's the duty of a good plastic surgeon to recognize what the patients are telling you and breaking that into mini little problems and attack the problems appropriately for the patient.
Okay.
So that at the end, things are subtle. Same complaints, but different procedures were done.
So does as a surgeon, I mean, you're creating the beauty in this particular case. So your definition of beauty has to match theirs, or?
You have to listen to them. Even though they're saying the same things, I look tired, but that gets translated into different procedures for the same patient. You have to look at the skin texture, their habits. Are they sunbathing? Are they using skin products? What they're trying to achieve. Listen to the husbands sometimes. Look at the before pictures from way before, and formulate the plan that's appropriate for them.
Now, is it common people bring in their partners in on the consult? Do you like that or not like that?
Quite frequently they do, and actually I do like it because I would like to hear their story and what they have to say. And sometimes they're against it, but it's an art to be able to recognize to be able to recognize what the patients are saying, and at the same time convincing the significant other that they're in good hands, in safe hands, and she would like what.
Well, nobody wants their spouse to look different or pulled.
That's the complaint of most.
Is that the fear
of the husbands with the significant others, that they have heard on the news, they have read somewhere in newspaper or seen the pictures that facial procedures gone awry and it's hard to correct. So they're looking and convincing themselves that this is the
find the right
surgeon.
surgeon, though. I mean, you have to.
It's important.
Not only,
Yes.
I mean, you're biased. You feel board certified plastic.
Yes.
But also look at their work.
Look at the work.
Is that your message?
And the pictures don't lie.
Okay.
You have to see the pictures log. Even sometimes I encourage them to talk to my previous patients and hear it from them firsthand. You know what their experience was.
I know you want to be positive. You said I don't want to say anything negative, but I mean, some guys have it and some guys don't.
That's
I mean, do you
correct.
believe that?
And as humble as I would like to be, yes, that's correct. You know, field of plastic surgery is not made to.
So be careful, because I mean, people live a long time today. You're going to be stuck with that face.
And for the most part, you want to get it right the first time, obviously. It's harder to go back in and correct someone else's mistake, even though it's possible, but we would like to get it done the first time. Right?
All right, and this is good stuff, by the way. We have time for one more photo.
And the last photo that I would like to show is pretty much the climax of all the procedures. And this is a lady who is somewhat older than the pictures that I've shown. And basically, she has the complaints of all those ladies combined together. My neck, the folds around my mouth, my eyes, the bags under
like mid-60s? How old is this person?
She's about mid-60, very pleasant lady. Spends a lot of time in the sun. She has a horse ranch in Texas. And she's got a very aged look and very poor textured skin. A lot of lines around her eyes. So we pretty much had to take a different approach to her. Not only we are going to rejuvenate her and shift her, we're also going to make her look younger by resurfacing the skin. So we pretty much threw everything at her.
So this is a full facelift?
Correct.
Candidate.
And this lady brought a picture of herself 20 years ago, and obviously you can see a beautiful lady. And she had complete facial rejuvenation, meaning that not only the structures were changed, but the skin was resurfaced. And
so when we look at the after,
you can see how much younger she looks.
Huge difference.
The neck is much tighter, the jowls have gone, the corner of the mouth, the lines are gone. Under eyes, there are no lines or bags. Much, much younger, much happier looking.
I'd say 20 years younger. Right?
Easily, at least.
Is that what?
Yes.
I think anybody would see that.
Very happy, but she doesn't look artificial. She just looks younger.
Interesting. Artificial.
Yes. That's the term.
So a lot of people, I guess, are doing artificial facelifts.
If you're inexperienced, correct.
Okay.
You can overdo a part and not necessarily address another part, and the face becomes very disharmonious.
It's good stuff. I want to thank you for coming to the show. Final message.
I guess the message I'm trying to get out there is that if you're not happy with the way you look, there are procedures out there, but please make sure that you choose a plastic surgeon who's experienced in facial procedures, and not every procedure applies to everyone, meaning that sometimes surgery is a procedure, sometimes it's not. Facial fillers, Botox is the answer, and that will do it. The plastic surgeon you choose needs to have an artistic and a scientific view of the face.
Okay, I want to thank you so much for coming in. Very, very good stuff.
Thank you, Randy.
Great photos. And we'll have you back on the show to talk about some other procedures.
Look forward to it.
You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, or you would like to direct a friend to the interview, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.